in anterior route, one is oral and second one is sublingual. So we have discussed the oral route in first part of these videos. Now sublingual, the route by which the drugs is kept under the tongue. For example, we are using nepentine sublingually, clonidine, isoprenaline, methyl testosterone and misoprostol. This route is advantageous, safe, effective and acceptable. Even this route is easy route. The patient can keep the tablet itself without the help of any medical technician. Rapid absorption occur and onset of action is fast because in the tongue there is a bed of capillaries. These capillaries take up this drug, absorb this drug and provide the drug to the systemic circulation and bypassing the liver metabolism. So in this route is very safe if the drug undergo hepatic first pass metabolism. This route of choice for drug which undergo hepatic first pass metabolism. Disadvantages: limited drug can be administered just like misoprostol, nifedipine, clonidine, etc. If the drug is irritant, cannot be used by this way. If the drug is nauseant, cannot be used by this way. This route is contraindicated for local anesthetic drugs. And quick termination of drug toxic effect may be occur just by spitting the tablet. This point may be count in advantages, not in disadvantages. The next route is rectal root. This is the rectum, this is lower part, this is upper part. In the lower part there is external hemorrhoidal vein, in the upper part there is internal hemorrhoid vein. If the drug absorbed from lower rectum, the drug will go to external hemorrhoid and will not go to liver. But if the drug is absorbed from upper hemorrhoid, upper rectum, so the drug will absorb from internal hemorrhoidal vein and it will go to liver and metabolism will occur. Rectal route advantages: this is used in case of vomiting, unconscious patient. Unpalatable drugs can be given by this route. Drugs which are degraded by GIT enzyme or GIT acid can be given by this route. This route can be used for systemic as well as local effect. In this route, sometimes there is first pass metabolism and sometimes there is no first pass metabolism. If the drug absorbed from lower rectum by the external hemorrhoidal vein, so the drug will not go to liver and there will be no metabolism. But if the drug is absorbed from the upper rectum, the drug will get absorbed by the internal hemorrhoid vein and it will go to liver and again there will be hepatic first pass metabolism. Disadvantage: this route is not acceptable. Administration of the drug need expert technician, and if the drug need digestion before absorption, their drug cannot be given by this route. Thank you for listening.